And first of all, I want to thank all of you, including the media and press, for listening and being part of the solution to overcome this pandemic. Together, we will get through this, and we will be a better Virginia. The coronavirus situation continues to be fluid and fast-changing. As of today, Virginia has 67 cases and, unfortunately, 2 deaths. Our strategy must focus on mitigating and slowing down the spread of this virus so that our medical system has more time to prepare for the increased pressure that this will put on it. We must flatten that curve, but to do that, everyone must use common sense. Every single one of us has a personal responsibility in this situation. Every one of us has a role in being part of the solution. For example, that means do not go to St. Patrick's Day parties tonight. If you do, you are literally putting others at risk. We will get through this, but everyone must use good sense and good judgment. Today, we are announcing the following things. First, Virginia will follow the federal guidelines regarding gatherings of 10 or more people. As a doctor, I understand that this virus spreads through human-to-human contact. Droplets from sneezes or coughing if people are too close, or they can be left on objects like door handles and our cell phones. That's why it's so important that people stay away from close contact. Second, we strongly urge those aged 65 and over to self-quarantine. Please protect yourselves. It is important that we make sure older Virginians in this situation can still get food, medicine, and other needs met. Our state agencies, our food banks, faith-based groups, and other nutrition-based organizations are working hard to coordinate food services. This may look different in different communities, but everyone who needs food assistance will be able to get it. I also urge everyone to make sure you check on that older neighbor or your parents or grandparents. Help people out with grocery deliveries. Make sure that they're okay. Again, we all have a responsibility to one another. We understand that the 10-person standard will have an impact on a number of businesses across our society. It means that all restaurants, malls, fitness centers, and theaters must significantly reduce their capacity in compliance with this 10-person standard or close. Restaurants are encouraged to continue takeout options. I understand that this affects people's livelihoods. We are taking the following actions to help our workers. Because Virginia and the federal government have declared states of emergency, unemployment funds are available through the Virginia Employment Commission to help mitigate the impact on employees of these businesses as well as on the businesses themselves. We have waived the 1-week waiting period so workers can start receiving benefits right away. We know that rent and other bills won't wait. Affected workers and businesses can contact the Virginia Employment Commission for information on how to apply for help. Today, I am ordering that Virginia's 75 Department of Motor Vehicles offices close to the public. Online services will still be available, and we encourage anyone who needs to renew their license or vehicle registration and can do it online to please do so. For those whose licenses or registrations expire May 15th, we will grant a 60-day extension. People need to do the right thing. Everyone has a role to help mitigate the spread of this disease, of this virus. That starts with social distancing. It is critical that we all think not of ourselves at this time, but of others. Young and healthy people may think this won't affect them. but I hope they will think of their parents and their grandparents. And I urge everyone to think of their neighbors, their communities. Public health relies on every individual making responsible decisions. We all have a responsibility to each other. We can and will get through this difficult time, but we must work together to do so. Now we will hear from Virginia Health Commissioner Dr. Norm Oliver. Dr. Oliver, thank you.
Thank you, Governor. As the Governor said, we currently have 67 cases of COVID-19 in the Commonwealth. Since yesterday, that's an additional 7 new cases. And we are expecting results on about 48 other tests that are pending in our state lab right now. And there are tests that have been taken and are being run by LabCorp, Quest, and other private laboratories. So that number will increase. The Virginia Department of Health will be posting at noon each day the numbers that we have in the morning, so that would be one way to check this. And in addition, of course, there will be these daily news briefings by the governor. Among the cases that have occurred since yesterday is one case in a long-term care facility. And this is very concerning. This is our first case in a skilled nursing facility, and we are actively investigating this case, working in collaboration with this long-term care facility to isolate and make sure that the infection does not spread to others. The breakdown of those cases, the 67 cases, are 9 in Central Region, 18 in Eastern Region, 38 in the Northern Region, 4 in Northeast. We still have no cases yet in Southwest. While the majority of the non-travel related cases are cases that have been associated with other known cases, that is very local transmission, we have now begun to observe cases with no known exposure to a case, which is what we would classify as community transmission or community spread. So the likelihood of community spread is definitely there. Some local transmission, such as in the Peninsula Health District, has resulted in clusters of illness, which reinforces the importance of what the governor has talked about already, which is the social distancing. I would like to say also, for those young folks who think that they're not affected by this, I want to underscore what the governor said about how social distancing on your part will protect our elderly. It's also important to know that although 80% of those who get COVID-19 have mild disease, that statistic comes from looking at the pandemic in China. And everything that was listed as mild was everything other than the severe disease. So included in the mild category is some pretty bad pneumonia. I don't want you to think that you're just going to get a cold, okay? This is a serious pandemic, and social distancing is therefore something that we all should do and take seriously for ourselves, for our loved ones, and for the entire community. We currently have a testing capacity of about 300 to 400 tests. We have on order and will be receiving today more test kits, which should nearly double that amount of tests. Private companies are online to help us with the testing, and many of you heard from the federal government of plans to launch automated testing and drive-through test sites around the country. The first wave of that will occur in those areas that have been hardest hit, like Washington State and California. But Virginia is in that next phase that should get those tests from the federal government. So we will be ramping up our testing capabilities in the days and weeks ahead.